How to stop bleeding gums. Bleeding gums are one of the first signs of gum disease. Proper dental hygiene and nutritious diet are the cornerstones of healthy gums and teeth. If you suffer from bleeding gums, take steps to understand the underlying reason behind the condition and how to treat it. Method 1. Stopping the bleeding. 1. Apply a cold compress to the gums. As an immediate solution for bleeding gums, you can apply a cold compress to the area. This helps to slow the blood flow to the area, resulting in less blood loss. Make a cold compress by wrapping an ice cube in a clean piece of paper towel. Hold it against the bleeding gum, applying gentle pressure. 2. Change your toothbrush and brushing technique. Bleeding gums are often caused by using a toothbrush whose bristles are too hard, or by brushing your gums too vigorously. Although you might think that harder brushing will result in cleaner teeth, this is actually not the case. Brushing too hard can damage tooth enamel, the protective surface on teeth, and irritate sensitive gum tissue, causing redness, swelling and bleeding. Buy a toothbrush with soft nylon bristles that have blunted, rather than pointed, ends. When brushing, use a gentle circular motion to brush all sides of the teeth, almost as if massaging the teeth. Brushing your teeth vertically starting from the gum line and moving over the tooth surface removes the highest percentage of bacteria compared to other movements. Most people tend to use a vigorous back and forth motion, which is incorrect. This can lead to gum recession and erosion, which can make your teeth look longer and stained. It's a good idea to invest in an electric toothbrush with a rotating and oscillating head. These toothbrushes are gentler on teeth and gums, but still more effective at removing plaque. Look for toothbrushes that are approved by the American Dental Association. For more information on the correct method of brushing your teeth, go to this article. 3. Be careful when flossing. Flossing is an essential part of maintaining good oral hygiene and should be done at least once a day. However, many people make the mistake of snapping the floss between the teeth, which can irritate the gums and cause inflammation and bleeding. It's important to be gentle while you floss. Slowly and carefully slide the floss between your teeth, following the curve of each tooth. Hold the floss so that it forms a U shape around the tooth, slide the floss below the gum line, then move it firmly up and down to remove plaque. Even though it can be a little awkward, don't forget the teeth at the back. For more information on how to floss correctly, see here. You can also use an oral irrigation device, known as a water pick, which attaches to the tap in your bathroom to shoot a small but forceful jet of water at your gum line, helping to clear debris. Buying a professional water pick is also a good choice if you have dental implants, bridges, or even periodontitis. 4. Avoid alcohol-based mouthwashes. Using mouthwash is a great way to freshen breath and eliminate bacteria from the mouth. However, alcohol-based mouthwashes are very drying, which can be irritating for swollen gums and cause them to bleed. Instead of alcohol-based mouthwashes, rinse out your mouth with hydrogen peroxide or salt water. These will keep your mouth clean and fresh, without irritating the gums. Method 2. Improving the health of your gums. 1. Brush and floss daily. Although many people's response to sore, bleeding gums is to cut back on brushing and flossing until the irritation dies down, this is the worst thing you can do. The only way to get your gums back to a healthy condition is through good oral hygiene, which involves systematic brushing and flossing. Although dentists typically recommend brushing twice a day, people with gum disease should brush more frequently, preferably after every meal or snack. You may also want to use a gum stimulator, which promotes constant blood flow to the gums and prevents inflammation. You should also floss at least once a day, making sure to floss below the gum line on every tooth, to remove the maximum amount of plaque. You should also floss before you brush, so any bits of food or bacteria that you dislodge from between your teeth will be brushed away, not left to sit in your mouth. Also remember to brush your tongue, as this is a major breeding ground for bacteria. 2. Eat a healthy diet. Eating a balanced diet is important for healthy teeth and gums, and can help to prevent gum disease. Try to eat lots of whole grains, vegetables and fruit, as these will provide you with the vitamins and minerals you need to stay healthy and ward off disease. Fruits and veg high in vitamin C, such as bell peppers, kale, broccoli, berries and citrus fruits, are particularly important. Dairy products such as milk, yogurt and cheese provide calcium and they are important for strong teeth and healthy gums, particularly in children, and should be consumed instead of soft drinks or any other acidic beverages. They help to clear sugars from the mouth, thus preventing bacteria build up and plaque. Avoid eating foods full of sugar or processed carbohydrates, as these contribute to plaque and can be damaging to teeth. Also avoid snacking too much between meals and eating before bedtime. 3. Quit smoking. In case you weren't aware, smoking is bad news when it comes to the health of your teeth and gums. Toxins in cigarettes and tobacco make your gums more prone to inflammation and disease. They also negatively impact your body's immune response, making it harder to fight infection. Smoking also interferes with blood flow because nicotine constricts blood vessels, reducing blood flow to your gums. This leaves your gums undernourished, causing them to become fibrous and swollen. Smokers are 6 times more likely to develop gum disease than their non-smoking counterparts, and tend to develop more serious gum disease, which often requires tooth extraction, as smoking lessens the success rate of other treatments. 4. Minimize stress. When you are stressed out, your body produces more of a hormone called cortisol, which negatively affects the health of your teeth and gums. More specifically, cortisol decreases inflammation, creating vessel constriction, which increases blood pressure. It also affects the immune system, making it harder for your body to ward off disease. Stress also increases adrenaline and glucose blood levels, which can contribute to diabetes. You can reduce your stress levels by getting better quality sleep, by exercising more often, and by spending time with your friends and family. 5. See your dentist at least twice a year. You should visit your dentist at least twice a year, or more if you have pre-existing teeth or gum problems. Only your dentist can perform a professional and thorough cleaning by using instruments that clean the parts of your mouth that cannot be reached simply by brushing and flossing. Don't let the cost put you off. Catching a gum disease or other tooth problems early will help save money in the long run, as you will require less extensive treatment. Once you're there, you can ask your dentist how often she recommends you get a cleaning. Method 3. Understanding the causes of bleeding gums. 1. Identify the cause of bleeding gums. Bleeding is a sign of unhealthy gums and may be caused by a gum disease or other medical conditions. It is important you understand the cause of bleeding in order to take the appropriate steps to prevent it. Bleeding gums could be caused by poor oral hygiene. Irregular brushing or flossing, or performing these actions incorrectly, can lead to gum disease such as gingivitis and periodontitis, which are common causes of bleeding gums. Brushing too hard with a toothbrush older than 3 months. Being too vigorous with your brushing or using an old toothbrush can inflame delicate gum tissue and cause it to bleed. Hormonal changes. Hormonal changes caused by pregnancy, menopause, or menstruation can increase blood flow to the gums, making them more prone to bleeding. Medical conditions. Bleeding gums can be a symptom of many medical conditions, such as bleeding or clotting disorders, conditions of immunodeficiency, diabetes, heart disease, cancer, and scurvy. Certain medications. Blood-thinning medications can make your gums more likely to bleed, as can several other medications, such as antiepileptics or contraceptive medication, which dry out or thicken your gums. Vitamin K deficiency. This vitamin helps in aiding your blood to clot properly. Thus, vitamin K deficiency can cause gums to bleed. Hereditary factors. People with certain genetic markers are more predisposed to developing gum disease than others, making them more prone to bleeding gums. Unbalanced bite. Having an unbalanced bite due to crooked or crowded teeth, clenching or grinding can lead to excess pressure in certain areas of your mouth, inviting gum disease and bleeding. 2. Understand the consequences of a gum disease. It is estimated that in the United States, gum disease affects about 3/4 of adults over the age of 35. The main cause of bleeding gums is gingivitis, a condition characterized by inflammation and swelling of the gums. Gingivitis is caused by excess bacteria in the mouth. The bacteria come from the fermentation of carbohydrates. This leads to inflammation, which is a protective response of the gums. Bacterial growth usually develops due to poor oral hygiene. Luckily, gingivitis is often reversible, provided good oral hygiene practices are introduced and maintained. If left untreated, gingivitis can lead to a more serious form of gum disease called periodontitis. Periodontitis significantly weakens the gums and bone that hold teeth in place, which eventually leads to tooth loss. Research links gum disease with higher instances of health complications, such as heart disease, stroke, chronic kidney disease, pneumonia, osteoporosis, cancer, and preterm birth. Therefore, it is very important to catch and treat gum disease early. 3. Visit your dentist. If you notice that your gums are bleeding and suspect that you might have gum disease, it's highly recommended that you make an appointment with your dentist immediately. Your dentist can confirm the presence of gum disease and come up with a plan to reverse or treat the damage. Your dentist can give your teeth a good professional cleaning and instruct you on how to properly care for your teeth and gums at home. If the gum disease is more advanced, your dentist may recommend scaling and root planing treatments to remove stubborn plaque and help gums to heal. Medications may also be prescribed in order to reduce the amount of oral bacteria. In serious circumstances, tooth extraction, laser treatments, or dental surgery may be required in order to halt the progression of periodontitis. Tips: use a disclosing tablet to temporarily stain the plaque on your teeth. This will give you an indication of how effective your brushing and flossing is. Disclosing tablets are available at the drugstore. Brush daily and use a disclosing tablet, as this tells you how effective your brushing is and how well you are brushing your teeth. These can be found at local drugstores and are not too expensive. Warnings: see your doctor, not just your dentist, if bleeding gums persist, as they could be a symptom of a more serious underlying illness.